Obstetrician Gynecologist Dr. Benden is here today from Gundersen Health System. She's here today to talk specifically about cervical cancer prevention. So thanks so much for joining us. You know, a lot of people may not realize, but 12,000 women each year are diagnosed with cervical cancer. Of those, about a third will lose their life with that cancer diagnosis. So the Pap test that a lot of women would have annually is really the best way to try to find out whether or not you have those precancerous cells. How important is that test still to this day?
That test is very important. There have been modifications to the test as time has gone on. We now detect precancerous changes with the kind of traditional Pap smear, but we've also added what we call co-testing, or testing for HPV.
And HPV is a human papillomavirus, and a lot of people may not realize they usually just associate it with cervical cancer, but it can actually be responsible for many other cancers too.
That's correct. It can affect both men and women. It can cause oral or head and neck cancers. It can cause vulvar cancers, which are cancers on the skin in the genital area. It can cause penile cancers and anal cancers, in addition to cervix cancer.
And it does seem like there are more cases of those now too than there used to be.
That's correct. There are more cases now. Since the Pap smear was instituted in the United States, we've had over 50% reduction in cervical cancer. It's a very preventable cancer, and the best way to prevent that is to have your children vaccinated with the HPV vaccine.
Okay, and when you talk about the Gardasil or HPV vaccine, that's a 3-dose vaccine. At what age do they start? And it's for boys and girls now too, not just girls.
That's correct. It's for boys and girls. They can start at the age of 11 to 12. It's a series of 3 shots, and they get that over the course of approximately 6 months.
Okay, and it's important to get all 3, so you don't want to stop after 1 or 2. You really should have all 3. And then what is the age now that's really recommended to start getting your first Pap for women?
For women, getting your first Pap smear should be at the age of 21, and between the ages of 21 and 29, they should be getting Pap smear screening every 3 years. And then after the age of 29, we add co-testing with the HPV as part of the routine screen.
Well, Dr. Benden, thanks so much for joining us today too.
You're very welcome. Thanks for having me.